Hello everyone, welcome back to my YouTube video channel again. Today I would like to review with you another case that I did about 6 months ago. Patient came in having the accident right on tube number 8. She broke it, she lost it, and she came in with the tube on her hand for about 10 days already. Her lip and everything were lacerated, bruise on her eyes, everything. I don't know what happened to her. She lost it. According to her, she said the swimming pool party and she lost control, hit on the pavement, and it just evokes the tube away out of her mouth. So we went ahead and cleaned out the granulation tissue, placed some bone graft, put the implant on that day, gave her a temporary crown, and gave her healing abutment as well as a temporary crown. I used her permanent natural tube as the temporary crown, and this is about 6 months later, or somewhere about 4 months, 6 months later. I took out the healing abutment and finished the case, and pretty much this is the abutment they provide me. I did not request gold abutment, but they gave me. I'm going to try in. I'm not very happy with the internal look already for the anterior teeth. It's supposed to be at least zirconium, but the lab have miscommunication, so I don't like this. But let's see how it turned out, and I'll show you what we're gonna do next if we don't like the way the collar look. Okay, it's considered trying right now. As you can take a look, the color are not 100% what I want. I don't like the internal golden color. So I asked them, I'm going to put in her mouth, give her some time. If she have a problem, I might just go ahead and tell the lab to make me a zirconium abutment, because that would give me a better chance of improving her whiter color. So this is a try-in, guys. I don't like the way it look already. So in my mind, I'm going to block it. When I wouldn't cement this, I'm going to block with some Teflon with a whiter color. I'm going to place on top of that, and then we go into cement it at the permanent. But in the long run, if she doesn't like it, I probably have to take it out and tell the lab make me a new one, which is the lab we use a digital impression, so there's no things to worry. As you can see, I put the Teflon underneath that. So I'm hoping the color will be whiter. As you can see right now, the color is actually whiter than the before I did the without the Teflon on top. So I just cement it. It's a dual care cementation process. I'm going to clean up this cement in a minute. So I just want to see, you can take a look and appreciate what I have done is changing the internal part of the gold into a whiter shape, and I actually see the whiter color on the tooth right now. Right now we are going to go ahead and do a curing light quickly on the margin, and so I can peel off the accessory cement. And after we do remove all the accessory cement, we will have to floss. After we floss, we have to take x-ray to confirm if we have to see anything. And usually you think that you remove all of the cement, but sometimes you don't. So the x-ray will help you also. Also, you have to use the clinical evaluation with the Explorer, go around under your margin. As you can see, the margin is just right at about ½ millimeter below the gum. So you can't go that deep to because there's nothing underneath that. As long as you catch the cement where your margin is, and that's where you should inspect it. So right now, I'm looking at the lingual part. As you can see, there is space of the healing abutment and the permanent abutment right now. So I will explain to the patient that she needs to continue, maintain her gum, get it healed, get it completely healed up, normal. And as you can see on the distal facial aspect of the gum, you can see I did have to do a little bit of minor gum surgery a few months ago because the patient were wearing a temporary and she doesn't floss, she doesn't use the water flosser to remove the plaques, so therefore there is some infection, and I did took it out and cleaned it up. That's where there is some kind of scar. I'm hoping it's gonna heal well when we do this. Just want to show you, this is a temporary crown that I'm using. I use the permanent tooth structure of the patient. I cut it in half. I remove the internal part. I reline with the flowable composite. As you can see that I try to get as close the gap as possible. Anyway, I just want to show you guys, you know, in the real scenario, you can have to figure out some way somehow to get the improve your case outcome as much as possible. Patient was surprisingly very happy with what I delivered for her today. In fact, we took some picture together. So it's okay for me to post it on internet, on social media. So here we go. I hope you have a great day. I'm sure this is not what I want, but I will try my best. Next time I will order the zirconium abutment and remove this one and deliver the patient for the better deal. I don't like the result, even though the patient is happy enough. Thank you for watching. Have a great day, everyone. Enjoy your day. Bye-bye. And do me a favor, guys, subscribe to my channel, hit the like button and share to everyone. And thank you again for being a subscriber. Have a great day.